Welcome back to the deep dive. Okay, imagine this. You go out to check on your horse, right? And instead of the usual munching, it's just standing there, straining. And not just once, repeatedly. Like it's trying really hard to pass manure or urine, but nothing much is happening. It's puzzling, and frankly, it can be pretty alarming to see. Now, this isn't just some odd habit, it's actually a clinical sign, a really critical one called tenesmus. And it's something we all need to understand better. So fundamentally, tenesmus is this repeated, kind of uncontrollable feeling of needing to evacuate, usually the rectum or the bladder. But the key thing is there's often very little or sometimes nothing actually being passed. It's super important to remember. Tenesmus itself, it's not the disease, it's a sign, like a big red flag waving, telling you something deeper is wrong. Our mission today in this deep dive is to really unpack this. We're going to look at where it comes from, and the origins are surprisingly diverse. We'll explore how vets figure out the actual cause, and then what the best strategies are for managing it. The goal is that by the end of our chat, you'll have a really clear, comprehensive picture. A shortcut, basically, to being well-informed on this vital topic. So, yeah, let's jump right in. Okay, so to really get our heads around tenesmus, what is it, fundamentally? It's that persistent, uncontrollable straining, not just, a single effort. This intense urge happens because nerves down in the lower spine, the sacral nerves, they're getting constantly stimulated. And this irritation, it usually stems from inflammation or maybe physical pressure on organs like the rectum, the uterus and mares, or the urinary bladder. The really tricky part is that this nerve stimulation just keeps going. It doesn't stop, making the horse feel that constant urge, even when there's, well, nothing left to pass. Now, the cause could be intrinsic, right? Like a problem within the organ itself, maybe inflammation in the rectum or diarrhea or a serious bowel inflammation like colitis, even a rectal tear. But it's not always internal. Sometimes it's physical pressure from outside, like really hard constipated feces blocking things up.
Or maybe an abscess near the rectum.
Exactly, or even growths, masses in that pelvic area. And here's where it can get quite serious. If that straining just goes on and on unchecked, it can actually push organs out, like a rectal prolapse. Or in mares, you could see the uterus prolapse through the vagina, or even the bladder pushing out through the urethra.
Wow.
And interestingly, it seems to be statistically more common in adult female horses.
Yeah, and what's really critical here, and something that often gets confused, is the difference between tenesmus and other terms that sound, well, pretty similar, like dyschezia and dysuria, or its specific form, stranguria. You can think of tenesmus as like the broad umbrella term. It covers straining that's related to problems in both the lower digestive system and the lower urinary system. Now, dyschezia, that's much more specific. It refers to difficult or painful defecation, so straining just to pass stool, often linked to issues right at the very end of the digestive tract, the anorectal area. Tenesmus can certainly be a part of dyschezia, but dyschezia itself is narrower.
Okay, focus just on defecation.
Right. And then you've got dysuria, which means painful or difficult urination. Stranguria is a specific, often severe type of dysuria where the horse is putting in an abnormal amount of effort, really straining hard just to empty its bladder. And being precise with these terms, it's absolutely vital in veterinary medicine. Honestly, misunderstanding what kind of straining you're actually seeing can cause significant delays in diagnosis.
Right, and lead to the wrong treatment path.
Exactly, which can make things much worse for the horse.
Yeah.
Imagine a vet assumes it's defecatory straining.
When really it's urinary.
Precisely. They might waste precious time investigating the gut while a critical urinary blockage, maybe a stone, is just sitting there unaddressed. It could be life-threatening. A little tip, actually, a subtle behavioral cue. Observe the tail posture. Horses straining to defecate often lift their tail quite high, whereas one straining to urinate might hold it down lower, more clamped. It's not foolproof, but it's a hint. And if we kind of zoom out, connect this to the bigger picture, this whole situation highlights a fundamental challenge in veterinary diagnostics, really. An animal's body, a horse's body, it has a pretty limited repertoire of ways to show us something's wrong inside. It can't just tell us my lower back hurts or my bladder feels irritated.
Yeah, it's all indirect signs.
Exactly. Straining, in this case, is a very general, nonspecific indicator of pain or discomfort somewhere in that caudal abdomen or pelvic region. Because it's so general, it demands a really comprehensive, holistic assessment. You can't just focus on the straining. You have to dig deeper to find the true root cause.
That makes perfect sense. The body's limited vocabulary for pain, as you said. Okay, so let's unpack this further. Let's dive into the diverse root causes of equine tenesmus. Where should we start? Maybe the gastrointestinal side. That seems like a major player.
Absolutely. GI causes are very common.
So one of the primary drivers is inflammation in the bowel. Vets often call this IBD, inflammatory bowel disease, or colitis. We're talking about the lining of the large colon or the rectum getting inflamed, irritated. And the causes, well, they can be pretty common, things like bacterial infections, viruses, parasites,
Sure.
but also non-infectious stuff too, like a bad reaction to certain anti-inflammatory drugs and NSAIDs. That can lead to a specific condition called right dorsal colitis.
Right, the NSAA toxicity.
Yeah, even just ingesting sand over time can physically irritate the gut lining. And when that inflammation happens, the bowel wall becomes hypersensitive, basically, really sensitive to stretch or pressure,
Hmm.
which leads to that persistent, often unproductive straining. It can even continue after the horse has passed some feces, just because the irritation is still there.
Okay, so inflammation is one big category. What about physical blockages? Obstructive lesions, I think you called them.
Yes, obstructions are another major group.
And you mentioned a key clue earlier, if the horse is straining before any feces pass. Exactly. That strongly suggests something is physically blocking the way in the lower colon or the rectum.
And what kind of things cause these blockages?
Well, common culprits include severe constipation, sometimes called obstipation, where the feces are just abnormally hard or large. Often happens if the gut isn't moving properly
Right.
or the horse isn't getting enough water.
Like meconium, impaction, and foals.
Precisely. That's a classic example in newborns. Their first stool gets stuck, other causes. Foreign objects the horse might have swallowed, or things called enteroliths.
Intestinal stones, right.
Exactly, stones that form in the gut. And then there's neoplasia tumors or growths. These can either block the inside passage or compress the bowel from the outside. Oh, and rectal strictures too. That's where the rectum narrows becomes constricted. That can cause those characteristic ribbon-like feces you might see.
Right, because it's being squeezed through a narrow opening. Okay, and then still on the GI side, there are issues directly with the anus and rectum themselves, right? Like trauma or structural problems.
Yes, absolutely. Things like anal sac disease, where the glands around the anus get inflamed, impacted, or even abscessed. Or structural issues like a perineal hernia.
And you mentioned rectal tears earlier. That sounds serious.
It is potentially very serious. They can happen from foreign objects, maybe bite wounds, or sometimes, unfortunately, even during a veterinary rectal exam if things don't go perfectly smoothly.
And the signs are straining and bleeding.
Often, yes. Tenesmus and fresh blood are common signs. And critically, if it's a full-thickness tear, a grade 3, that's an immediate surgical emergency. There's a huge risk of peritonitis, a severe abdominal infection.
Wow. Okay, so that covers a lot on the gastrointestinal side.
It does. But it's so important to remember straining isn't always about the gut. Sometimes the problem is urinary.
Right, the urinary tract causes. Let's talk about those.
Sure. So, again, inflammation is a key player here, too.
Okay.
Conditions like cystitis, that's bladder inflammation, or urethritis, which is inflammation of the urethra, the tube bleeding out, these can cause that protracted, difficult, often unsuccessful urination. You might see a weak stream or dribbling, and often blood in the urine hematuria.
Even kidney infections.
Yes, pyelonephritis, a kidney infection, can sometimes manifest with straining as well. And there's a condition called sabulous cystitis.
Fabulous.
Yeah, it's where calcium carbonate crystals, sort of like sand or sludge, build up in the bladder. This causes constant mechanical irritation to the bladder lining.
Oh.
Exactly. It leads to that persistent, painful urge to urinate, even if the bladder isn't actually full. And here's where it gets, well, I find it really interesting, urinary stones, urolithiasis. They're quite common culprits for straining, especially straining to urinate.
Stones in the bladder or urethra?
Precisely. And they are significantly more common in male horses, especially geldings.
Why is that?
It's down to anatomy. The male horse's urethra is much longer, it's curved, and it's less stretchy, less distensible than a mare's.
Ah, so it's easier for a stone to get stuck.
Exactly. It predisposes them to stones getting lodged and causing an obstruction. Knowing the horse is male often really helps narrow down the possibilities when you see urinary straining. And finally, on the urinary side, don't forget neurological issues. Nerve problems can affect bladder control. You might get issues with the nerves controlling the bladder muscle itself or the sphincter that holds the urine in. This could lead to bladder paralysis.
So the bladder can't empty properly, urine dribbling.
Right. Or, conversely, you might get increased resistance in the urethra, making it really hard to pass urine. In both scenarios, the horse often strains excessively trying to compensate. Even something as seemingly simple as lumbar pain, back pain, that prevents the horse from adopting that normal urination posture can contribute indirectly by leading to incomplete emptying and potentially predisposing them to issues like that sabulous cystitis we mentioned.
It's truly fascinating, isn't it? How many different systems can ultimately lead to that same basic sign straining? And besides the big categories, digestive and urinary, you mentioned some other, maybe less obvious causes,
Yeah, there are a few miscellaneous but still important ones. Sometimes it's extrinsic compression.
meaning pressure from outside.
Exactly, like a mass growing in the caudal abdomen, or maybe even a pelvic fracture that's healed improperly and is now pressing on the rectum or bladder.
Okay.
In male horses, particularly stallions or older geldings, prostatitis inflammation of the prostate gland, or just an enlarged prostate, can cause pressure and straining.
Makes sense.
And surprisingly, sometimes adverse drug reactions can manifest this way. Certain intravenous plasma products, for example, have been reported to cause transient tenesmus, sometimes along with rapid breathing.
Huh. That really underscores the need to look at the whole horse, doesn't it? The entire clinical picture. Okay, so let's shift gears. A horse is showing tenesmus. How do vets actually figure out what's really going on? You said it's a systematic process.
It absolutely is. It starts with careful observation, recognizing those clinical signs we've been talking about.
Right, the how of the screening.
Exactly. How long are the efforts? Is anything being produced? And critically, that timing relative to defecation
Straining before feces suggests.
often points towards an obstructive lesion in the lower bowel.
And straining that continues after feces are passed.
That's more suggestive of inflammation or irritation, maybe colitis or proctitis.
And you mentioned specific postures, too.
Yeah, sometimes, like a deep squat might make you think more of colitis, whereas a horse that's sort of pacing or walking slightly while straining might be dealing with constipation. They're not definitive, but they're clues, non-invasive clues you get right away.
And beyond the straining itself, those associated signs are key, right? The flags, you called them.
Definitely. Often those associated signs are more specific than the straining itself.
So for digestive issues, you might look for.
Diarrhea. Yeah, typically large bowel diarrhea may be increased frequency but scant volume. Or hematochezia, which is fresh blood in the feces. Or excessive mucus.
And for urinary problems.
You're looking for hematuria blood in the urine, polyuria, that's frequent urination, often small amounts, maybe dribbling urine or observing a weak or even absent urine stream.
Okay. And then there are the more general systemic signs that the horse is really sick.
Right. Things like colic signs, lethargy, anorexia, not wanting to eat, fever, a fast heart rate, maybe abdominal distension, signs of dehydration. These tell you it's likely a more serious systemic issue. Building on those observations, the next step is the hands-on physical examination, and especially a careful rectal palpation that's often incredibly informative. A thorough physical exam starts by inspecting and palpating that whole perineal region, checking for pain, swelling, hernias, issues with the anal sacs, any obvious masses. Feeling the abdomen externally might reveal a large, tight bladder if there's a urinary obstruction, or maybe a small, painful bladder suggestive of cystitis. You might feel the colon distended with hard feces and constipation. These direct findings give immediate clues, then the detailed rectal examination. It's considered highly valuable in horses, but I really have to emphasize it requires an extremely careful and gentle technique.
Because of the risk of causing tears.
Precisely. The risk of iatrogenic rectal tears is real and serious. But done carefully, it yields so much information. You can directly feel for tears, maybe a palpable roughening or a defect in the rectal wall, sometimes with blood on the glove. You classify the grade. Remember, grade 4th is the emergency. You can also palpate for obstructive lesions like strictures or masses inside the lumen or large fecal impactions. And you can assess other structures back there, anal sacs, prostate in males, urethra, check for any abnormal masses in the caudal abdomen.
Okay, so physical exam and rectal are key first steps. What if more information is needed? That's where advanced diagnostics come in.
Exactly. When the initial exams aren't definitive or sometimes aren't feasible, like in a tiny foal or a horse straining too violently, imaging is crucial. Ultrasonography is incredibly versatile. It's non-invasive, gives you real-time images. It's brilliant for emergency triage.
What can you see with ultrasound?
You can quickly detect fluid accumulation, either free fluid in the abdomen, suggesting peritonitis or maybe bladder rupture, or urine buildup in the bladder itself. You can assess intestinal motility, wall thickness. Using a probe transrectally lets you evaluate structures around the rectum, look for tumor invasion, thickened bowel walls, fluid. Transabdominal ultrasound lets you look higher up, assess stomach distension, overall gut health. Look for stones in the bladder, check the kidneys.
And endoscopy, using a camera.
Yes, endoscopy is fantastic. It provides direct visual confirmation of what's going on inside. You can see inflammation, ulcers, masses, foreign bodies, and crucially, it allows for targeted biopsies. Taking small tissue samples is often essential for getting a definitive diagnosis, like distinguishing between inflammatory bowel disease and cancer, for example.
And does endoscopy offer more than just diagnosis?
Oh, absolutely. This raises an important point. Endoscopy is also therapeutic. It allows for minimally invasive procedures.
Like what?
A great example is laser lithotripsy for bladder stones. Using the endoscope, a laser fiber can be passed into the bladder to break up stones without needing major abdominal surgery.
Wow, that's much better for the horse.
Huge difference. Less morbidity, much faster recovery, improved welfare. So, vets can use scopes to look directly into the rectum and colon rectoscopy, colonoscopy, or into the bladder cystoscopy to diagnose and sometimes treat problems right then and there.
What about x-rays? Radiography?
X-rays are primarily used for skeletal issues, looking for pelvic fractures, other bone abnormalities. They can also be helpful in diagnosing rectal tears sometimes, or visualizing meconium impaction in foals.
And MRI? That seems very high-tech for horses.
It is, but it provides incredibly detailed images of both bone and soft tissues. It's the gold standard for complex foot issues, like navicular disease. In the context of potential causes of discomfort that might be misinterpreted as straining, MRI can be invaluable for diagnosing subtle or deep-seated soft tissue injuries or bone pathologies that could cause significant pain or lameness.
Okay, so imaging gives us the visuals. What about lab work? Blood tests, urine tests?
Essential. Laboratory diagnostics provide crucial information about the horse's overall systemic health, the degree of inflammation, potential infections. Blood work, a CBC, complete blood count, and a serum biochemistry panel gives you that systemic overview. It helps assess severity, things like dehydration, shock, systemic inflammation. For instance, a high pack cell volume, PCV, and total protein, TPP, indicate dehydration. Elevated white blood cell counts point towards infection or inflammation. Low protein might signal protein loss through the gut. Electrolyte levels can be severely deranged, especially with acute colitis.
And urinalysis, if you suspect a urinary cause.
Absolutely critical. Urinalysis directly confirms urinary tract involvement. It detects blood, pus, pyuria, crystals, abnormal pH. It strongly supports a urinary diagnosis and helps guide further tests or treatment.
And fecal analysis.
Direct route to identifying infectious or parasitic causes of GI inflammation. Fecal egg counts for worms, direct smears for protozoa, bacterial cultures for things like Salmonella or Clostridium. This guides specific deworming or antibiotic therapy.
That diagnostic blueprint is incredibly thorough. It really shows how vets piece together the puzzle. So once there's a diagnosis, or at least a strong suspicion, how is tenesmus managed? You said treatment needs to be prompt.
Yes, expedited treatment is often crucial, especially because of that risk of organ prolapse we discussed. And the treatment strategy depends entirely on the underlying cause and the potential for, or presence of, prolapse. It's often a multifaceted approach. Medical management is usually the first line. Pharmacological interventions are key. Anti-inflammatories are commonly used. NSAIDs like phenylbutazone or flunixin help reduce pain and inflammation. There are newer, potentially safer options like filocoxib, which is more selective.
But NSAIDs have risks, right?
They do. Potential for gastric ulcers, right? Dorsal colitis, kidney damage, especially if the horse is dehydrated. So careful use is essential. Corticosteroids are more potent anti-inflammatories, but they come with their own risks, like suppressing the immune system or potentially triggering laminitis. If bacteria are involved, like in septic arthritis causing pain or infectious colitis or cystitis, then antimicrobials, antibiotics, are needed, ideally guided by culture and sensitivity testing to choose the right drug.
What about for constipation?
Laxatives and stool softeners are the mainstay, things like mineral oil administered via nasogastric tube or adding psyllium husk or bran mashes to the feed. And sometimes an epidural anesthetic is given. Injecting local anesthetic into the epidural space near the tailhead numbs the perineal region, reducing the straining reflex and pain, often done with sedation to keep the horse calm and facilitate procedures.
Okay, lots of drug options.
Absolutely. And don't forget fluid and electrolyte therapy. It's absolutely vital if the horse is severely dehydrated or has significant electrolyte imbalances, which is common with something like acute colitis. Aggressive intravenous fluids are often necessary.
And diet. Does that play a role in management?
A huge role. Dietary management needs to be tailored to the cause. For constipation, the focus is on increasing water intake and fiber, think soaked hay cubes, beet pulp, plenty of good quality forage, maybe smaller, more frequent meals. For inflammatory conditions like colitis or IBD, you want easily digestible, high-quality forage, maybe reducing the particle size. Supporting the gut microbiome is key. Sometimes elimination diets are needed to identify trigger foods.
And for urinary stones?
The main goal there is often to reduce calcium intake. That means restricting feeds high in calcium, like alfalfa and other legumes. Ensuring constant access to fresh water is crucial. Sometimes urinary acidifiers might be considered, but that needs careful veterinary supervision.
So that's medical and dietary. What about when surgery is needed?
Surgical intervention becomes necessary for many obstructive lesions, for severe inflammation that isn't responding to medical therapy, or for structural problems. Rectal tears, for instance. Minor grade of first tears might heal with conservative management, but more severe grade third or fourth tears absolutely require prompt surgery, cleaning up the edges, suturing the defect to prevent fatal complications.
And rectal prolapse.
Small, recent prolapses might be manually reduced and held in place with a temporary purse string suture around the anus. But if the tissue is damaged, irreducible, or necrotic, then surgical resection removing the damaged part is required. For rectal strictures, sometimes gentle stretching or balloon dilation can work, but severe or recurrent cases might need surgical resection.
And urolithiasis, the stones?
Surgical removal is often the definitive treatment, either via an incision into the bladder, cystotomy, or sometimes through the urethra, perineal urethrostomy in males. But as we mentioned, minimally invasive options like laser lithotripsy through an endoscope are becoming increasingly common and are often preferred when feasible. And of course, other obstructive lesions like tumors or foreign bodies generally require surgical excision.
You also touched on therapies that might seem indirectly related, like for musculoskeletal issues.
Yes, and it's an important point about overall well-being. While things like regenerative therapies, stem cells, PRP, or physical therapies like shockwave, laser, hydrotherapy, therapeutic ultrasound, while they aren't direct treatments for tenesmus itself, they play a vital role in managing underlying musculoskeletal conditions.
Because pain from those could be confused with straining or just add to the horse's overall discomfort.
Exactly. A horse in chronic pain from, say, a tendon injury or arthritis might exhibit behaviors that mimic straining, or the overall stress and discomfort could exacerbate other underlying conditions. Managing that pain effectively improves their quality of life and can be part of a holistic recovery plan, even if the primary issue causing the tenesmus is something else entirely.
That makes sense. It's about treating the whole horse.
Yeah.
So we've covered causes, diagnosis, treatment. What about the prognosis? The outlook for a horse with tenesmus, you said it varies.
It varies enormously. It really hinges on the specific underlying cause, how severe it is, and crucially, how quickly and appropriately treatment is started. It's definitely not a sign you can afford to wait and see about.
What are some of the major complications if it's not treated properly or promptly?
The consequences can be severe, even fatal. We mentioned rectal tears, especially grade 3 and 4 perforations. They can rapidly lead to septic peritonitis and endotoxic shock. Even if they heal, incomplete healing can result in chronic problems like abscesses, fistulas, or strictures later on.
And rectal prolapse.
If it's neglected, the exposed tissue can become ulcerated, infected, swollen, and eventually lose its blood supply, leading to necrosis or gangrene. In mares, it can even progress to involve the small colon prolapsing too. And recurrence after treatment is unfortunately quite common. With urolithiasis, a complete urinary obstruction is an emergency. It can lead to bladder rupture, which is often fatal if not addressed immediately. Kidney stones, nephroliths, generally carry a poor prognosis as they often cause irreversible kidney damage and eventually renal failure.
What about severe colitis?
Acute colitis can be devastatingly rapid. If untreated, horses can quickly become severely dehydrated, go into hypovolemic shock. Other potentially grave complications include laminitis, a debilitating hoof condition, blood clots, bleeding disorders, severe protein loss leading to edema and secondary infections. And just the act of chronic straining itself, regardless of the cause, it severely impacts the horse's quality of life. It means ongoing pain, discomfort, stress, potential weight loss, behavioral changes. While very rare, extreme abdominal pressure from chronic straining has even been linked to stomach rupture in some cases.
Wow. It's absolutely clear then. Tenesmus is far more than just a simple symptom of trying too hard. It's a critical warning sign. It demands immediate attention and a really thorough investigation. We've seen how vital it is to differentiate it accurately and how crucial that meticulous physical exam and those advanced diagnostics are to getting to the bottom of it.
Precisely. An accurate diagnosis followed by prompt tailored intervention, that's what's absolutely paramount. It's what optimizes the outcome for the patient and helps preserve their long-term health, welfare, and potentially their performance career. It really is about looking beyond the obvious sign to find and fix the underlying problem.
And thinking about this whole discussion, it really raises an important question, something for you, our listeners, to consider. Given that the horse's body, much like other complex biological systems, often channels diverse internal problems, diverse discomforts, into a fairly limited set of outwardly observable signs like straining, how might understanding the complexities behind something like tenesmus challenge your perspective? How might it change how you think about diagnosing those subtle, underlying issues in other complex systems you encounter, whether they're human or otherwise? Something to mull over.